And we're so glad to welcome another representative from Merck, Carmen Villar, Vice President, Social Business Innovation for Merck. Please welcome to Concordia, Carmen.
Hi, Kevin, and thanks so much for that introduction. At Merck, we know that public-private partnerships can be catalysts for promoting the health and well-being of women and girls. This is why we are invested in the Go Further partnership with PEPFAR, UNAIDS, and the Bush Institute to address the healthcare needs of women in the developing world. Go Further serves as an important example of how the strategic coupling of women and adolescent girls' health with economic empowerment and capacity building has resulted in stronger societies across Africa, according to both economic and health indicators. Our panel today will discuss the results achieved through Go Further and how the synergistic contributions of multiple stakeholders, including the private sector, government, and the community, drive results and promote sustainable programs. Before we jump in with our panelists, we were able to have Holly Kuzmich of the Bush Institute and Ambassador Deborah Birx of PEPFAR connect a few days ago and start us off with this interview video.
Good afternoon, everyone. It's great to be here. We were able to catch Ambassador Birx a little bit early before the conference. We know she's got such a busy schedule, so we're grateful she took the time to join us today to talk a little bit about our Go Further partnership, which is a partnership between the Bush Institute, PEPFAR, UNAIDS, and Merck to really address cervical cancer, particularly in sub-Saharan Africa. The Bush Institute really leverages our convening powers and educational efforts. PEPFAR, of course, leads the on-the-ground implementation and drives so much funding to this issue. UNAIDS is a strong voice on advocacy and communications and really engages civil society. And Merck, of course, brings their significant health expertise to bear, especially on prevention and improving the lives of women living with HIV. So Ambassador Birx, can you tell us, how's the partnership going? What do our results look like to date?
Well, thank you, Holly, and really thank you to President and Mrs. Bush for their continued really passion and dedication to the people around the world. Thank you for the investment originally in PEPFAR. It's that very platform that has both provided HIV care, but also COVID services right now. The laboratory infrastructure that was built by PEPFAR is the structure being utilized for diagnosing COVID around the world, and it's our people on the ground on the front lines and our partners that continue to execute. We're also very excited about the progress and Go Further to be able to really already in the first a little over 2 years to reach over 1 million women with HIV, screen for cervical cancer, and more importantly, 87% of the women we have served in the last 24 months had never been screened before. Over 6% of them had early lesions that were treated, and another 1.5% had invasive carcinoma of the cervix that is being also treated. So this partnership, and it's refocused on the most at-risk women, is really providing the necessary screening and treatment for women in resource-limited settings. And because of its success, we're adding countries each year. We've invested nearly $100 million, and we're proud to continue this partnership and continue to support women around the world.
So, Ambassador, can you talk a little bit about the connection, what you're hearing from clients about the connection between their health and economic empowerment? We have gotten much smarter about why those two matter together and how one impacts the other.
Well, we know women are often the backbone of any society, but women, particularly in resource-limited settings, are not only providing for their family and their care of their children, they're also the economic powerhouse often in these families. And so healthy women, both healthy from HIV perspective and healthy from cervical cancer, are really critical to ensure both the foundational safety of the family, but also the communities and therefore the countries. And so really this support to women allows women the opportunity to economically thrive in a healthy way because they're healthier. And I think really understanding we bring that kind of economic focus both in this program and in PEPFAR, but also in our young women's program called Dreams, and being able to treat women as a whole and understand their unique issues that need to be addressed to support them in their activities has really been part and parcel of both PEPFAR and Go Further.
Well, Ambassador Birx, I just want to thank you for your leadership at PEPFAR and for what you're doing on COVID-19. We wish you the best of luck, and we can't wait to see you at some point soon. Thank you.
Great, thank you.
What a great video that was. Thank you to Holly and Ambassador Birx. I'm really joined by two extraordinary women today. Please join me in welcoming Dr. Shannon Hader, the Deputy Executive Director of UNAIDS, and Dr. Sharon Kapambwe, Assistant Director for Cancer Control at the Ministry of Health in the Republic of Zambia. Great to see you. So I'm going to go ahead and jump right in with Dr. Kapambwe. Maybe you could talk to us a little bit about what you see as the responsibility of the Ministry of Health and or the government in your country in public-private partnerships like Go Further.
The role of government in public-private partnership is really to ensure that they strengthen these and promote public-private partnership. One of these is making sure that there's legislative framework that is available for the private partners to work in. We're also talking about strengthening the coordination of the PPPs that are in the country. And you're also looking at enhancing the harmonization, ensuring that the way the work of the private sector is with the government is in a way that everybody is benefiting from this coordination. One of the things that we have to look at is that the government is also responsible to give policy direction, because once there's a policy direction, then the private sector, when they come in, they will understand. So if they find, for example, Go Further comes in and they find that a country like Zambia has a national strategic plan, it's much easier to buy in, because then the government has given a roadmap of how they want the country to run, of course, in collaboration with other strategic documents that are available globally. You're talking about the global strategy for cervical cancer elimination. You're talking about the SDGs. You're also talking about the National Health Strategic Plan for the Ministry of Health. So the government has a role to ensure that policy is given. They have a role to ensure that they promote the participation of this private sector by ensuring that they've put the frameworks in place. So if somebody is coming from the private sector, they have and they make investments. That investment is protected through MOUs, the Memorandum of Understandings that are signed, the letters of agreement, and each one knows it's about mutual responsibility and also a mutual respect of the private sector and of the public sector.
That's great. That last point is really important as we think about a true collaboration. Thank you, Doctor. Dr. Hader, women and girls are particularly vulnerable to HIV/AIDS in sub-Saharan Africa, with adolescent girls and young women twice as likely to be living with HIV than young men of the same age. And we've heard you say before that women and girls are more vulnerable to a host of diseases, including cervical cancer. UNAIDS has worked to encourage the leadership and inclusion of communities, especially of women living with HIV, to drive, we hope, better outcomes. How has UNAIDS put women at the center of its work?
Yes, well, let me start just by saying thank you to the Bush Institute and to Merck and to PEPFAR. We just are thrilled to continue to be a strong partner and go further. And, when it comes down to it, putting women at the center really starts with having bold goals about their health, made with women for women. And I think this Go Further partnership is bold. The 12 countries that were the initial focus that are some of the highest HIV rate countries in the world, the goal is to reduce new cervical cancer by 95% among the 7 million women living with HIV in those countries. That's huge. So first is the bold goals. Second is also thinking about how. And this is where, as you mentioned, Carmen, communities, including networks of women living with HIV and young women, have been critical to the how of Go Further. So it's not just the clinical services. It's also young women living with HIV, playing a role in raising awareness for cervical cancer, generating demand for screening services, ensuring referrals and supports and connections across those services, providing accountability, saying is the quality at the clinic what we were told to expect. And I think because this partnership engages at all levels, that is really why more Go Further countries have done exactly what Dr. Sharon just said. They have cervical cancer integrated into their national AIDS strategic plans. And very many of them have now included cervical cancer in their global fund applications as well, which is huge. And how is this paying off for women? You heard a few numbers from Ambassador Birx, but really as of March of this year, Go Further Partnership has supported over 1 million cervical cancer screenings for women living with HIV, treated over 50,000 women for pre-invasive cancer. And, that's critical because there's an estimated 100,000 women diagnosed annually with cervical cancer in sub-Saharan Africa. So those big, bold results are coming out of those big, bold goals.
Wonderful. I couldn't agree more. That's great. Thank you. And I hope we're seeing some of these results and positive results in Zambia as well. Going back to Dr. Sharon for a second, how have partnerships with the private sector increased your efficiencies or service delivery for better outcomes for women across various indicators?
So if you're looking, and if you particularly want to look at cancer of the cervix and looking at the partnership, the Go Further partnerships, we know that women living with HIV are 4 to 6 times more likely to develop cancer of the cervix compared to women who are not living with HIV. And Zambia has an HIV prevalence of 11.3%. And when you look at who come in with invasive cancer of the cervix, women who are in the reproductive age and they have invasive cancer of the cervix are most likely also HIV positive. So we're talking about women who are also the economic backbone, as we heard from Ambassador Birx and as Shannon has mentioned. What are some of the efficiencies that Zambia has benefited from such a partnership? If we start not just with the women, we can start with the young girls. We have seen that we have HPV vaccination and we have private sector participation. And we find that young girls are getting vaccinated against HPV. And then we also look at HPV testing that we are having as well. And these are some, and you find that by having HPV testing, we're increasing the number of women who can get screened for cervical cancer as well, and also a high performance test. And knowing that later we'll be able to have a reduction in some of these diseases. A woman is really the center of a community in our setting. And if you look at economic inclusion, and if we look at the rural areas in Zambia, majority of the women, 80% of them are producers of food. So if we're ensuring that we're screening these women for HIV, we prolong their lives with the life-saving drugs, but we also ensure that these women are also getting screened for cervical cancer, which could take them away, even though they're drinking these life-saving drugs. And then that means that we're removing the people who are producing food. So by having these partners coming in, there's also economic inclusion that is coming in. There's also economic participation, empowerment of these women. So it's from the girls up to the women. It's in the treatment sector as well. We find them early. The outcomes for treatments are much better.
Great. Thank you. And going back to Shannon for what I think will be our last question, you mentioned cervical cancer being included in the HIV strategic planning, which is fantastic in Zambia. And Go Further works to layer cervical cancer services onto services for HIV and women's health. What other opportunities do we have to push for women's equity through multi-sectoral, multidisciplinary approaches, especially for women living with HIV?
Yeah, as much as HIV is absolutely a health issue, it's always been about more than just health. And we know a lot of factors that drive vulnerabilities and inequalities for women are absolutely relevant to HIV prevention. For young women, this includes education, income, safety from violence. And so For example, keeping women, young girls in school through secondary school can reduce HIV rates from 25 to 50%. It's like a vaccine education. And so one of the things UNAIDS is working on right now is what we hope will be a game-changing initiative for the empowerment of young women in sub-Saharan Africa called the Education Plus Initiative. And among other things, one of the things it does is to challenge government decision makers at the highest levels to really fulfill some essential duties, and brings an added call to persuade governments to roll out universal secondary education, free to girls and boys. Now, I think that evidence confirms that girls, their communities, their countries reap multiple social and economic benefits from completion of secondary school. And I know I don't need to tell the crowd watching this that investing in human capital, keeping girls in school, is also a critical element to building strong businesses and strong economies. So importantly, the urgency of this has gotten even more critical during COVID-19, when we see so many more kids out of school and subject to the vulnerabilities sometimes at home. And so I really hope that everyone, and especially the private sector, will be part of this call for bold leadership and new investments to say, when the world goes back to school, let's make sure girls go back to school. To call to leaders to say, now is not the time for austerity. Now's the time to invest in the future, invest in secondary education, invest in the future of women.
Great. Thank you. And again, I want to just thank my wonderful panel for this short discussion we had today. And again, the Bush Institute and PEPFAR. And thanks to Concordia for giving us this time today. It's an honor and a privilege for professional women like this panel to be involved in efforts around eliminating cervical cancer and working on ending the epidemic of HIV. There are so many lessons that we're learning through our COVID experience as well. And we can't forget that one critical factor, with women and girls at the center of our communities and at the center of the care and the health of our families. So thank you very much, and have a great rest of the program.